Good morning, I'm Michelle Chang. I'm presenting on behalf of our team. I'm a general surgery resident at the University of Arizona. We have no disclosures. At the University of Arizona, we have multiple rotations where we have exposure to robotic surgery. This year, we sought to develop a formal curriculum where we started off with training junior residents on the basics of bedside assist and using the virtual reality simulator. Senior residents were taught dry lab exercises to practice more advanced skills such as suturing in confined spaces. Ideally, our thought was that these skills would translate into residents having greater proficiency with being able to sit at the surgeon console. And to improve our own curriculum, we sought to learn from existing curricula. Our objective was to review the literature of existing robotic curriculum and apply Kern's model for curriculum development. So these are the 6 steps for Kern's model of curriculum development. And specifically, we focused our analysis on steps 4, 5, and 6. So step 4 is education strategy, or the content and method for the training. Step 5 is implementation, and step 6 is evaluation and feedback. In our study, we looked through 5 databases and looked at articles ranging from 2001 to 2021. We selected articles that were specific to curriculum in general surgery and related subspecialties such as colorectal and surgical oncology. There was quite a range of robotic curriculum. Target learners ranged from novice learners to practicing surgeons, and the goals for the curriculum ranged from teaching novices how to use the basic features of the robot to training residents on specific cases such as robotic inguinal hernia repairs. In our study, we found that there was a range of education strategy. So most common was the use of the intuitive virtual reality simulator, about 36%. At a smaller percentage was the combination of using the simulator plus dry lab and simulator plus OR experience. And even more rare was the use of wet lab, animal lab, or cadaver. Additionally, we also found that there was a range for how learners were assessed and got feedback. Some non-validated methods were using video review by experts and the performance metrics from the virtual reality simulator. Some of the validated methods were the objective structured assessment of technical skills, or OSATs, and then the global evaluative assessment of robotic skills, or GEARS. So some of the conclusions that we came to that a lot of the existing curriculum have gaps that we identified. And the most common feature that we saw was that a lot of these curricula relied on the use of the intuitive virtual reality simulator. The simulator is great for training novice learners to use the robot, but it really doesn't bridge the gap as far as actually performing surgeries. A structured curriculum should incorporate all of the elements of Kern's model. And then lastly, future curricula should be designed with specific goals and targeting specific tasks for better transitioning from simulation to OR.